We explain to patients what chemotherapy is. The best way to describe it is really a group of drugs that we use to kill the tumor, preferentially kill the tumor, and given in several ways, but usually in set time periods over a given time period and set amounts based on patients' weight and height, for example. And the goal, hopefully, is to kill tumor cells with these chemical agents, uh, and less likely cause effects on normal tissues.
All cancer cells are faster growing than most other cells in your body, and so the chemotherapy actually targets the faster growing cells in your body, including the cancer cells. Chemotherapy usually involves either an IV infusion or a pill, but with the IV infusions, you basically sit in our infusion center to have the nurses administer that to you with some medications to keep you from getting sick. The more traditional chemotherapy, not necessarily older, which basically kills the faster growing cells, including the tumor cells, by disrupting their reproduction, basically. Then there are targeted therapies, which are more antibody-related therapies that attach to the tumor cells and affect it in some way, either by cutting down on blood vessel supply or destroying it directly. Then there are new vaccines that are working in a different way as well.
At Cancer Treatment Centers of America, one of the important things we do for someone who's coming to us and is going to be going on to receive chemotherapy is very early think about how hard chemotherapy can be on their veins. There are devices, we call them ports or venous access ports, which are put in with a minor surgical procedure, which allow us to give their chemotherapy more safely because they don't run the risk of hurting their veins. It also is much easier because you're not poking and prodding with a needle to find a vein. I call it a guaranteed stick. It's a very easy device to access.